Hello, welcome everyone. Dr. Max here at Maximal Wellness. I just got some patient results of the Omega-3 index, and I wanted to share those with you, but I also wanted to educate you all about what the Omega-3 index is and why it's so important, and what the latest research is showing us about how incredibly valuable knowing your omega-3 levels can be for all sorts of issues like heart disease, dementia, and even longevity and extending your lifespan. So, just get the disclaimer out of the way. This video is intended for educational, informational purposes only and should not be construed as medical advice, diagnosis, or treatment. The information presented is not a substitute for individualized care from a qualified healthcare professional. Always consult your physician or healthcare provider before making changes to your diet, supplements, medications, or healthcare regimen. And the products featured here in this video are simply based on my personal experience of use and are not an endorsement by any particular company or of any particular product. Now that we have the disclaimer out of the way, first we're going to go over what this test is. It is a very simple finger prick blood test that measures the percentage of EPA and DHA omega-3 fats. Those are the two active, powerful fats found in things like fish oil or algae oil that are very anti-inflammatory and supportive of all sorts of things in the body, like our heart, our blood, our brain, inflammation. And because these red blood cells live for 3 to 4 months, depending on how well you're taking care of yourself, the omega-3 index provides a very useful marker of that long-term omega-3 intake. So how have you been doing the last few months of life? Have you been taking your supplements? Have you been getting it through your diet? This is similar to how diabetics will check their hemoglobin A1C levels, the amount of blood sugar that's stuck to their red blood cells, and that's a measure of how they've been doing over the last several months. So the same idea here, but for omega-3s. And the current evidence, this is really cool, we're going to get into this in a minute, shows that the omega-3 index is one of the most useful biomarkers available if you're trying to evaluate your nutrition status and all sorts of risks for different chronic diseases. There are clear associations with the omega-3 index with heart disease, with heart failure, cognitive decline, your risk of dementia, and healthy aging. And as a bonus, all causes of mortality. Yes, that's all causes of death. So we're going to get into the research here. So the test I personally use, the omega-3 index plus, through standard process because I'm already very familiar with a lot of their products. I already have an account with them, so it's very simple for a patient or a client to use this omega-3 status test and just prick their blood, get a dry spot sample with that blood on the included paper, sent to the lab, and they evaluate the amount of omega-3s in the membranes of the red blood cells in that sample. And so it just takes a couple weeks to get the results, and then they will come out with a personalized report for you, why it's important, and different ways that you can get more omega-3s in your diet if you're not optimal. And I'll show you an example patient after we go through the research. So how it is scored when you get your results, if there's less than 4% of those red blood cell membranes that have those omega-3s, the EPA, DHA, you're at high risk of things like heart disease and Alzheimer's, dementia. If you're getting 4 to 8, that's sort of intermediate. What the research is showing is we really want to see more like 8% or more. Optimal would be more around 10 to 12%. So in terms of cardiovascular disease, heart disease risk, this is the strongest evidence for testing the omega-3 index. A study last year found that omega-3 index significantly improved your risk prediction for developing cardiovascular disease, heart disease, even when added to the standard equation that they use for heart disease risk assessment. And even when they took out the traditional risk factors like what's your blood cholesterol like? How high is your blood pressure? Are you smoking cigarettes? Do you already have diabetes? Even when you exclude those factors, they found that the omega-3 index test was still helpful for evaluating your risk of heart disease. So it's really useful when you do or do not have those risk factors. So it's useful for, I'd say, just about everyone, in my opinion. The researchers then proposed that this index could be eventually a routine test alongside things like cholesterol because it's such an easy test to do, and is easy to track over time and is a modifiable thing that people can do by changing their diet or their lifestyle. Just really simple to do. In terms of heart failure, a 2024 analysis published by the Mayo Clinic found that higher omega-3 levels were associated with a lower incidence of having heart failure to begin with, reduced mortality from heart failure. So even people that were developing heart failure had a lower risk of dying from it. Reduced cardiovascular mortality. So we're talking about the blood vessels all throughout the body, not just in the heart, and lower overall risk of death. They concluded that the omega-3 levels appear to be a meaningful predictor of future heart failure outcomes and survival. So whether you're someone who's trying to avoid heart failure or have a history of that, this may be a useful test for you to see how well you can do if you're trying to support your health. Very cool. The omega-3 index is useful for predicting all causes of mortality. So not just heart disease, not just heart failure, but cause of death by anything, really. This was a pooled analysis of 17 different studies with over 42,000 participants, and they found that those with the highest levels of omega-3 had a 15 to 18% lower all-cause mortality risk. So, if I could do one thing to lower my risk of dying by any cause, 15 to 18%, an omega-3 is a pretty simple way to do that. Lower cardiovascular mortality, as we've already talked about, and lower mortality by certain cancers, which is very cool. Because we think about what are some of the biggest killers in the developed world. We're talking about things like heart disease, cancer, diabetes. So if you can help to lower the risk of dying by those causes, you're doing yourself a huge favor when it comes to living in the Western world, like here in the United States where I live. These associations are still present even after you adjust for confounders. So again, we're finding that this research is consistent even when you account for things like diabetes or smoking or blood pressure issues or high cholesterol. And the research has concluded that higher circulating levels of those active EPA, DHA, omega-3 fats are consistently associated with a longer lifespan and a lower risk of premature death. And we'll show you a little more information about that in a second. When it comes to brain health and cognitive decline, that's another major cause of disease and can be just a real heartbreaker when you or someone you love is starting to experience cognitive decline or is at risk of things like dementia, Alzheimer's. A 2023 meta-analysis of 48 studies all put together, over 100,000 participants in this meta-analysis found that higher blood levels of omega-3s were associated with about a 20% lower risk of developing dementia, reduced cognitive decline, and a lower disease risk of developing Alzheimer's, which is a type of dementia. The long-term omega-3 supplement users in one group had a 64% lower risk of developing Alzheimer's when they were going into follow-up and evaluating later on after they've been doing that for a consistent period of time. And their blood markers of the EPA and DHA were associated with better cognitive outcomes. Another systematic review from 2 years ago found that omega-3 status, how much omega-3 you have in your blood, may support cognitive performance in those even without dementia. But they found that the results may depend on the population you're working with and other diet and lifestyle factors. So we know from the previous research that we just talked about that it can help with heart disease, it can help reduce the risk of heart failure or dying from heart failure, it can support reducing your risk of dying from all causes, but it also seems that the omega-3s are helpful for people even without cognitive decline, and it may even help cognitive performance and function. An important caveat with that, of course, is that the evidence is stronger for the prevention and the risk reduction than for treatment. So studies of those who already have Alzheimer's disease generally show minimal cognitive improvement from omega-3s or fish oil supplements alone. In terms of aging, longevity, and biological age, researchers, this came out last year. This was really cool. I found this one fascinating. Followed about 800 older adults in Europe for about 3 years, and they found that daily omega-3 supplements help to slow down biological aging as measured by different markers in cells for how fast a person is aging. Rather than their physical age, like I'm 35, we're checking markers in the blood and the cells to see how old the actual cell age is compared to other populations. So even though I might actually be physically 35, if I've had a lifetime of stress and smoking and drinking alcohol and not exercising, sitting around, eating junk food, my biological age may be a lot older than I physically am. But what this study showed is that daily omega-3 supplements can help to slow down that process, and that effect was even amplified in people if they were also taking vitamin D, which is a very important pro-hormone that is used by all different types of systems in the body. We have receptors for it all over. It's not just good for bone health, as well as exercise. But those effects were still present even when you didn't add the vitamin D or the exercise. I'd like to just add that. So we're just talking about the omega-3s. The participants experienced lower rates of infection as well. Falling down and injuring, which is a major cause of death in a lot of my older patients. As a chiropractor and a functional medicine doctor, we're always working on trying to improve coordination and balance and bone density and strength so we can prevent things like passing away from falling and breaking a bone or something like that. Reduced frailty and some reduced incidence of some cancers, which is very cool. And although the reduction in biological aging was kind of modest, we're talking 3 to 4 months, biological age lower, say over 3 years. So you're taking that omega-3 supplement daily for 3 years. You're going to get about 3 to 4 months lower on your biological age. The investigators suggested that these effects could have a meaningful population level effect if sustained over time. So they can help to add healthy years to later life. So you think about if there's one easy thing you could do, say over the next 10 years, say taking a fish oil or an algae oil or having sardines on a regular basis, that could give you another year to your life. And we're talking improved life as well because you're reducing heart disease risk, cancer risk, cognitive decline risk, reducing your overall biological age. I'd say omega-3s is a pretty easy way to do that. So I wanted to give you a real example. So this is a real patient results that I just got a couple days ago. This is a woman I've been working with in her 30s, high stress job. She says that her stress level is just a 10 out of 10 every day. She's just incredibly stressed and as a result is sleeping very poorly, also has a family with small children. So that doesn't help when you have a baby sleeping in the bed with you, waking you up all night. This person is getting little exercise outside of just moving around during her job. So probably not very consistent there. This person had a history of taking fish oil regularly, but had been so stressed out and sleeping very poorly, not exercising that she hadn't for the last several months. I thought this was also a useful case because this person really hates seafood. I've tried to get them to, hey, have you considered salmon? Have you considered sardines? This woman just, nah, not for her. If she's going to do the omega-3s, it's going to be through supplements. So I thought this is a great example of how just supplementation can reflect your body status rather than having to eat fish all the time if you're not a seafood person. So right away, the first level they give you is the omega-3 index. Those red blood cells in the membrane. How much of the EPA and DHA fats do we have here? And here we have over 6%. So we're not optimal, but we're definitely not in the high risk category. So we put this more in the intermediate risk of developing things like cardiovascular disease, cognitive decline, not as much of a reduction in things like all causes of mortality, cancer, things like that. So we're trending towards where we don't want to be. So this can be a good wake-up call if you had been taking omega-3s for a while and kind of stopped or didn't see the point after a while. This can give you some quantifiable data to see where you are in terms of your risk of all of that research that we just talked about. So this report also from OmegaQuant also lets you know in terms of total omega-3 versus omega-6. So there are two major dietary fats we're getting, the omega-6s and omega-3s that are used for all sorts of different things, but popularly, you'll see a lot on social media and things, related to inflammation. So the omega-6s both promote and reduce inflammation depending on the type of omega-6 you're getting, but omega-3s are pretty much exclusively just anti-inflammatory, help to resolve and calm down inflammation, which is why there's all the hype around omega-3s. So this gives you an overall view of all the total omega-6 versus omega-3s. Because another thing that's very important to know is if you're supplementing with omega-3s, but you're also having them at the same time that you're having a lot of omega-6 fats, whether that's a lot of seed oils or you're having a lot of red meat at the same time you're taking your fish oil, your body won't be able to absorb as much of either of them at the same time. So ideally, if you want to get and absorb more of those omega-3s, those fish oils, the fish that you're eating, have them away from other types of fats, red meats, shellfish, certain seed oils as well, and then you'll absorb more of that. So this gives you an overall omega-6 to omega-3 ratio, and for this person, 6.7 to 1. So again, we're not really bad, but we're not ideal. So we're sort of in the middle, and we're trending towards getting worse because this person hasn't been taking their omega-3s for a couple months. They also list AA versus EPA. AA is short for arachidonic acid. This is one of the major omega-6 fats classically associated with promoting inflammation, creating inflammation, say after an injury. But if you develop chronic inflammation from eating, say, a lot of omega-6s and you never resolve the chronic injuries, don't deal with chronic infections, you're already always stressed, there'll be more of that inflammatory behavior from the arachidonic acid, the AA. And the EPA is one of the active, powerful omega-3s that your body uses to create all those anti-inflammatory compounds. So relating those two big players right there gives you a better idea of inflammatory load rather than just total load of omega-6 to omega-3. Because remember, omega-6 is both pro-inflammatory and anti-inflammatory. So there's some more nuance there. But if you're comparing AA to EPA, that gives you a better idea of how much inflammation versus anti-inflammation activity you got going on. So this person had a more ideal range compared to their total, so not so bad. So even though they weren't getting as much omega-3 because they weren't supplementing for the last couple months, they were still pretty close to the ideal range, which is good because a lot of Americans really aren't. And that can be a problem. Promotes inflammation, increases your risk of heart disease, cognitive decline, certain cancers, as we've just talked about. They also include the trans fat index. Now, trans fats in the American diet are much lower than they used to be because they've been taken out of a lot of our processing and a lot of oils that you can get commercially, say from donut shops, or if you're eating processed snack foods, or from certain fast food restaurants. So we do like to see that less than 1% because trans fats are not really found in nature. It's hard for your body to really use them. It's just not really good. And there's all sorts of health consequences associated with having higher trans fats in your diet and in your body. So this was really good. This person's not eating a lot of processed junk foods that would be increasing trans fats. They also include a list of common sources of EPA and DHA fats, so all the different seafoods. For this person, this wasn't really relevant because they hate seafood. But, if they ever were going to have something like some cod, or some tilapia, or some shellfish perhaps, there are some omega-3s in there, the EPA, DHA. And you can see some of the higher ones like herring, salmon, tuna. With some of these fish, of course, the predator fish, you also want to be careful. If you're eating a lot of tuna or a lot of predator fish, they tend to be higher in things like mercury, heavy metals, plastics now. So if you can eat more of these smaller fish, like anchovies and sardines, I would say that that's preferable to having more of the predator fish that may have other heavy metals or problematic things in them that you don't want in your body. Let's see, where was I? Yes. So a special hack here. If you happen to be a vegetarian or vegan, you can get a supplement as an algae oil. So the algae is where a lot of these fish get their omega-3s from. So if you're a vegetarian or vegan, you can cut out the middleman, don't have to worry about eating fish, and you can get an algae that is rich in the EPA and DHA fats. Other plant-based omega-3 fats that you can find in things like flax or chia, if you grind them up, or hemp seeds, they have this ALA. That ALA fat needs to be turned into EPA and DHA to really get the benefits of those anti-inflammatory effects from the omega-3s. And in the human body, that's a very poor and slow conversion process. You're not getting very much EPA and DHA from eating just those plant-based omega-3s like flax. So if you really want to change these markers, a much better idea would be to get an algae oil if you happen to be a vegan or vegetarian. The bottom line is that the omega-3 index is now one of the most evidence-supported biomarkers in preventative medicine, and current research links higher omega-3 values with reduced heart disease risk, lower heart failure incidence, improved cardiovascular disease risk prediction. So years and years before you develop heart disease or atherosclerosis, you can see your risk of developing that down the road years before that even presents. Reduced risk of dementia and cognitive decline. It helps to slow biological aging if you're taking that regularly. Remember, 3 to 4 months less biological aging if you take it every day for 3 years, and that's improved with vitamin D and regular exercise. And it helps to lower all causes of mortality. So you're reducing your risk of every cause of death by doing something simple and getting your omega-3s. How cool is that? So if you want to learn more, my name is Dr. Max. My clinic is Maximal Wellness. I work with people with chronic digestive issues like IBS, SIBO, IMO, inflammatory bowel disease, and more. I also work with people with high blood pressure, diabetes, helping to try and reverse, slow down that process in a natural way along with their primary care doctors or their specialists. So feel free to reach out. My website's www.maximumwellness.com, and let's get you feeling well. All right, thank you for your time.